So Brian, I'm really glad I was able to move you to a more comfortable position for you. So let me give you a bit of information. So I've listened to your lungs and your lungs are clear, which is good. I've assessed your vital signs and they're all within normal limits. Now remember, vital signs are all relative to the patient's anatomy and physiology. We don't really care what the textbook says with respect to their vital signs. So what I'd actually like to do now is give you a medication that might help you with some of your discomfort that's affecting your heart. And that medication is called nitroglycerin.
Nitroglycerin? What's that for?
That's a really good question, Brian. How is nitroglycerin really working in the body? What is the mechanism of action? And that's probably the most important thing. See, if you ask most people about nitroglycerin, they'll tell you, that's a vasodilator. Well, that is true. It does vasodilate. But really, why is it doing it and how does it work? And so when you give nitroglycerin to a patient, believe it or not, it's not the nitroglycerin that causes the vasodilation. No, what nitroglycerin does is it releases something called nitric oxide. And you produce nitric oxide naturally in your body. You do it all the time. So to give you an example, when you're walking around during the daytime, we're all walking around in what's called a state of tone, which means we're all a little bit sympathetic nervous system driven. Now at nighttime, when you're resting, everything slows down. Your heart rate drops, your blood pressure drops. And why does your blood pressure drop? Well, it does because your body naturally releases and produces nitric oxide, and that's what's causing the vasodilation. So when you give a patient nitroglycerin in the field, what you're doing is causing their body to react to that nitroglycerin by producing nitric oxide and therefore causing vasodilation. And that's a really fundamental, important thing for us to understand, because when we give medications to our patients, it's not good enough to know that, oh, the medication might do this one little element. No, we need to know how the medication is going to actually work in the patient's body. And so remember that next time you give nitroglycerin, think about nitric oxide. Now, if you'd like more information, please go to my website, which is www.currentecg.com. Now, if you're a Nova Scotia Paramedic Union member, this whole thing, all the premium content, access to the website is absolutely free of charge. So please visit us at www.currentecg.com. Now, if you're a paramedic out there and you're like, hey, I want to be part of that too, then get a hold of your union and have them contact us, and we'll see if we can arrange something to let you part of the current ECG community. And until next time, sugar, water, oxygen to survive. The eyes can't see what the mind doesn't know. And in Klein's world, who gets an ECG? Almost everybody. Stay current.